hearing me today. uh, Welcome to the seventh week of psychometry, 7 week of hard work, 7 week of seriousness. And I hope you are getting a lot of things from all these lectures. All right, so our focus is still on this psychological testing and for pastoral counseling. And of course, this week 7, we'll be looking at personality assessment with projective techniques using Rorschach, TAT, sentence completion, and their use in pastoral counseling. We have the reading for the week, the book Cohen, Psychological Testing and Assessment. We shall be reading part 4, chapter 11 this week, which has to do with personality assessment and overview, projective method. And when you look at page 402 following, you see a lot of things being said about personality assessment, especially projective techniques. And this will be of help to you. Whatever I'm giving here today is just an overview, it's not the detailed work. So I may not be able to do that in a video. One video may not be enough if I have to give the details about uh, our focus for this week. Let me start by saying that personality assessment seeks to understand enduring patterns of thoughts, emotion, motivation, and behavior. I've said this before. That is what personality assessment seeks to understand, the pattern, enduring pattern of the thoughts, emotions, motivation, and behavior. In Cohen's framework, personality assessment can be broadly categorized into objective method and projective method. When we talk about what we did last week, that was objective method, MMPI, NEOPI, NEOPI, if you remember, for those of you who still remember, those are objective methods. The second part is projective methods. So this week's focus is on projective technique. We have done objective. This week is projective. I hope that makes sense to you, right? So looking at the theoretical foundation of projective technique or techniques, projective methods are grounded in psychodynamic theory, the concept of the unconscious, the projective hypothesis. Now, I want to call your attention to what we are doing in personality theories and what we are doing in psychological testing. For those of you who are following intimately, you will understand that you see correlation, you see connection, all right, in what we are doing right now. If you can't see that connection, it means you have not been following. We're talking about personality theories, and now we're talking about psychological testing. So we are beginning to annex the two together. So when we talk about the projective hypothesis, right, when presented with ambiguous stimulus, individual projects such as unconscious conflict, desire, fears, and relational pattern, okay, ambiguity becomes a psychological mirror. So the overview of projective techniques, the common types includes number one, Rorschach Inkblot test. It's very popular. Number two, thematic Apperception test, TAT. Number three, sentence completion test. Number four, draw a person test. All right. So when we're talking about projective, those are the major tests we use to measure personality. But in this class, our focus will be the first three: research, Inkblot test, thematic apperception test, TAT, and sentence completion test. We are going to be focusing on these three. Okay, so looking at Rorschach Inkblot test. The test was named after the person who worked on it, Hermann Rorschach, which was developed in the year 1921. This consists of 10 standardized ink blot cards, and two, it consists of black and white and color designs. Clients ask, what might this be? Okay, that's the question client may be asking. What might this be? Responses are scored based on one, location, which is whole blood or parts. Location. Number two, determinants, color, movement, shading. Three, content. And four, form quality. Don't forget the question the client is asking. What might this be? The responses are going to be scored based on the location, based on determinant, based on content, based on form quality. Modern scoring uses the external comprehensive system. There's something we call external comprehensive system. That's what modern day scoring use because a lot of things are changing, you know, in 21st century, right? As technology improves, a lot of different things are coming out, especially in science. Okay. So what does it attempt to measure? We're talking about Rorschach's test. What does it attempt to measure? Number one is perceptual processes. Perception. Perception processes. Number two, thought disorders. Thought disorder. Number three, emotional functioning. Emotional functioning. Number four, reality testing. And number five, personality structure. Those are five things that Rorschach's test, Hermann Rorschach's test, Inkblot, try to measure: perception processes, thoughts disorders, emotional functioning, reality testing, personality structure. Those are five things it seeks to measure. What are the of Rorschach's test? According to Cohen, number one, it may reveal underlying thoughts disturbance. Okay. Number two, useful forensic or complex diagnostic setting. That's another strength. Number three, can detect disorganized thinking. Rorschach's test, very powerful. Number one, can reveal underlying thoughts disturbance. Number two, can be useful in forensic or complex diagnostic settings. Number three, can detect disorganized thinking. Many people have criticized Rorschach's test, Inkblot test. For example, Cohen highlights some concerns regarding it and talks about reliability inconsistencies. That's one of the things raised by Cohen. Number two, questionable validity. Questionable validity. Number three, cultural bias, especially when you want to take it from Western, you want to go and use it in the global South. There's going to be issue with cultural bias, and overinterpretation sometimes can be another problem. So those are the criticism around Rocha's test. Its scientific status till today still remain debated. Scientists are still debating on its scientific status. Let's look at the second one, TAT, thematic apperception test. This test was propounded by Henry Murray, a man called Henry Murray. It was developed in 1930s. 1930s. Participants views ambiguous social scene and create stories, including what led up to the scene, what is happening, what characters feel, what will happen next. And it seeks to assess the following. Number one, needs and motives. Needs and motives. Two, interpersonal patterns. Interpersonal patterns between few people or more. Interpersonal patterns. Then conflict theme. Conflict headings. Theme. That's what it seeks to assess. And of course, attachment dynamics. Attachment dynamics. When we're talking about attachment, we're talking about the relationship between child and caregiver, especially when they are young. If caregiver disconnect unnecessarily with the child and the child begin to develop attachment problem, when the child become adult, it's finding it difficult to be able to trust anybody. He will believe everybody will abandon, fear of abandonment. All right, so that comes in. So when we are talking about what TAT seeks to measure, attachment dynamic, the dynamics of those attachments. So the TAT explore narrative identity, narrative identity. Of course, there are some strengths around that. It has rich qualitative data, real qualitative data you can get, real qualitative as part of the strength of TAT. It's useful in exploring relational dynamics, useful in exploring relational dynamics. And of course, it's helpful in therapy settings, especially when we use it in the clinic, when we use it to support our client. It's very, very useful. Of course, there are limitations to that. To TAT, the subjective scoring is one of the limitations. Limited standardization is another limitation. Uh, Cultural variability in storytelling. Cultural variability in storytelling. These are limitations of TAT. Quickly, let's look at sentence completion test, SCT. You know, the format for sentence completion tests are this. Number one, client, client complete stems, such as I feel most anxious when the client will complete it. My father always dash 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 dash. The church is dash 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 dash. So sentence completion test. So if it depends on the type of test you want to carry it out, we will have it in a paper or on iPad or on a sheet of paper with pencil, give it to client to complete the sentences. right? So that can be helpful to do the assessment you want to do. The advantage of this is that you can administer it so quickly. It's very fast. It's less intimidating than Inkblot. It reveals thematic concerns, right? Useful in pastoral settings. Those are strengths, and it has, of course, it has its own limitation. Susceptible to impression management too. This limitation, and interpretation most time depends heavily on clinicians' skills. So that's why it's subjective and not strongly standardized. It is not strongly standardized. Looking at Cohen's perspective on projective method, what is the Cohen's perspective about it? Cohen, in our textbook, emphasized that the controversies surrounding validity. That's what Cohen keep talking about. That after you read your text for the week, you see that Cohen emphasizes the controversies surrounding validity. Cohen also emphasized, importance of appropriate training. Importance of appropriate training. Cohen lay emphasis on that. Cohen also emphasized the necessity of multi-method assessment. The necessity of multi-method assessment. And number four, Cohen emphasized ethical caution in interpretation. Ethical caution in interpretation. The key principle here is that projective tests should not stand alone in diagnosis. That's the key principle here. Projective tests should not in, stand alone in diagnosis. All right. The use of projective technique in pastoral counseling, when we bring it to our context, you see, one, it has potential benefits. When we look at pastoral context, projective method may facilitate disclosure. Yeah. And can also reveal spiritual conflicts the students are having. And can also surface attachment wound. Can surface attachment wound. I've explained that what that means the other time. The wound sustained when child was younger as a result of disconnection from the caregiver or loved ones or people that are important in their life can lead to abandonment issue, attachment problem. So this projective techniques can reveal attachment wound. And of course can also explore theological distortions. For example, a TAT story reflects abandonment may indicate unresolved grief. Sentence completion about God may reveal distorted theology. God is always dash dash dash. It will reveal, other person's concept or understanding or conflict that they are struggling with. Cautions in pastoral counseling, there are some cautions we need to take because pastors are typically not licensed psychologists. We are not licensed psychologist pastors. Generally, it's different from our training. So we have to be careful. We're not formally trained psychometric scoring. All right. So what makes me different from that is that yes, I'm a clergy, but I in my field of discipline, I'm into psychology. So I did all these things part of my work. That's why I said in some of the lectures that the fact that you are offering this course does not mean you can diagnose and assess people with mental health or personality disorder. You may not be able, you may need further training, you may need other training to be able to do that. If you are becoming a PhD holder, you must know a bit about everything. You can't know you can't know everything in details, but you must have idea of everything. All right, that's what we call PhD. You have idea about everything. You are not a novice in anything. Okay, so if you want to specialize in ability to use all these tests, we are saying you need to go for further training. So the caution there is that the fact that you are a pastor does not make you a psychologist, does not make you that you are capable of carrying out all this assessment and test. You still have to go for training. In some places, like where I am now, you have to be registered with the college before you'll be able to carry out this test. Right? So that's the caution. And you must be trained in psychometry. And of course, for because my major is psychology at my PhD level, then I offer the course alone, just on psychometric testing alone, just a course for a whole semester. So that we dealt with it from beginning to the end. So look at this course now, we're just passing. We are not saying on psychometric testing alone. We are talking about psychological testing as a whole. It's very broad. So that's a caution. Therefore, we must avoid diagnosing interpretation. Even if you have access to resources, to tools, we have to avoid formal diagnostic interpretation. Therefore, we need to use informally a conversational tool, not clinical tests. Conversation, through a conversation, when you are supporting people with the idea you are getting now, you can interpret, have understanding of what your client is going through, and you know how to support them spiritually. Of course, so not in a clinical setup. And another thing is that we must never present interpretation as definitive truth, as definitive truth. So the ethical consideration around this is that there must be informed consent, even whatever you are doing, informed consent, clear scope and competence. Let them know what you are doing is this. You're not diagnosing them, you're not, let them know, refer them when needed to the professionals. Avoid over pathologizing spiritual struggle. When people are struggling spiritually, don't pathologize it. You need to avoid doing that. And do not claim psychological authority without credentials. Don't tell them you're a professional, you can do that. Though you are offering this course now, you know it, but you are not a professional in this field as such now until you go for further training, which is very, very important. So, projective techniques require professional training when used diagnostically. Let me say it again. Projective technique requires professional training when using it, diagnostically. It requires. Let's look at the critique of projective techniques. Scientific concern, that's number one. Iterator reliability issue is there. Construct validity debate is there. Cultural interpretation bias is there. Replicability problem is there. And looking at the theological reflection, projective test, assume unconscious drive and hidden conflict structure. And of course, from theological anthropology perspective, humans are very complex. Motivation may include relational, spiritual, moral dimensions. Reduction to psychodynamic conflict may oversimplify. May oversimplify. The balanced position for students when it comes to projective technique is that contributed historically to personal assessment. That's it. It contributed to personality assessment. It highlights the narrative and symbolic dimension of personality. When we're using only these things, it requires caution and humility and should be supplemented with objective measure. Okay, in pastoral counseling, we use conversation, narrative exploration, and of course, reflective listening more than formal projective testing. You have idea of it, but you can't use it. But you can. What we do more is we converse with people. We use narrative exploration and reflective thinking. All right. This is very, very important. Let me conclude with this: that projective technique emerged from psychodynamic theory. That's where it comes from. It's a matter of conclusion, and it's aimed to reveal hidden personality structure. It offers qualitative richness, it faces significant empirical critique, and must also be used cautiously, especially in pastoral context. And that's what the Cohen's balanced approach remind us to, you know, follow this assessment requires, what assessment requires, which is scientific integrity, which is ethical restraint, which is multi-method strategy, and competence awareness. This is going to help us to be able to use all these things appropriate without committing any error whatsoever. If you have any question about all I've been saying today, please feel free to ask or send an email to me on our page. I will be able to provide answers to them as soon as possible. I hope you enjoyed this week. A lot of work for us to do this week. Please take time to check the reading for the week. And of course, I will talk to you again very, very soon. We should have a class this weekend, first Saturday at in the morning, meeting session. Okay, and I will see you Saturday. Take care, everyone.